Life is not the way it's supposed to be. It's the way it is. The way we cope with it is what makes the difference. Since 1978, COPE Services has been helping people who are struggling with life's challenges by providing both support and resources through 24-hour crisis and teen hotlines, senior citizen and school outreach programs, information and referral services, and an online database. COPE has been there hundreds of thousands of times, aiding and comforting people, whether they needed emotional support, information on available resources, or even suicide prevention. Each year, well-trained volunteer COPE listeners answer more than 22,000 hotline calls. While all COPE calls, callers, and listeners are anonymous, this video will describe the types of calls we commonly handle. Caller demographics are broad, from children home alone to senior citizens, wealthy, poor, employed, unemployed. At one time or another, and increasingly so when economic times are challenging, many people need help to cope.
I've taken calls from all kinds of people. College kids, a veteran who called from the hospital, some people who are just really lonely, and some who are so depressed they don't see a reason to keep living.
There's one woman I've talked to a couple of times. She uses COPE to deal with PTSD flashbacks from when she was raped. When it's really bad, sometimes she calls the priority line.
One priority line call was from a 71-year-old woman who was in such despair that she had taken a gun up to her room with the intention of killing herself.
A woman called really upset and frustrated because her family thinks she should be done grieving her husband's death.
After one of COPE's outreach visits teaching mental health in a school, a 10-year-old girl called.
COPE has a senior support line and senior support specialists to reach out to older adults, so a lot of senior citizens have our number.
A 77-year-old woman called because she was just exasperated by having to live with chronic pain.
One person I've talked to a couple of times told me that COPE is one of his tools for countering his addiction.
You'd be surprised by all the different kinds of people who use the hotline.
COPE's professional phone system has 5 hotlines and 2 dedicated priority lines for crisis calls. When needed, listeners have backup support from on-site staff, in-person crisis workers, or law enforcement. But the vast majority of calls are handled one-on-one by COPE's empathetic, supportive, non-judgmental listeners.
A recent call was from a middle-aged man who, after working his whole life, had been laid off and was losing his home because he couldn't find another job. He was devastated.
Some people call for referrals for services, like food pantries, shelters, or transportation services.
So he called COPE to get some information on low-income counseling, which we were able to help him with.
One caller was really sad about her parents' divorce and wanted to talk through some things with someone she could trust, but didn't know.
She confided that one of the ways she's handling her grief is to drink.
If something triggers her and she needs to talk to someone right away, she calls COPE.
She told me that she'd been cutting herself because she's stressed and depressed.
She was paying more for childcare than she was earning, and she wanted to know if COPE could help her in any way.
Each time COPE answers the phone, it's with the intention of reducing the caller's stress by the end of the call. That emotional support has been repeatedly shown to keep people out of crisis.
We're trained to ask crisis callers if they intend to hurt themselves and if they have the means and a plan. If they do, we get a staff member on the phone immediately to help. There's a very specific way those calls are handled.
I suggested a grief support group, and she said she was willing to try it. The database had one not far from her.
And also told her about a no-interest loan program that helps working families buy used cars. She had no idea such a thing existed, so she could never have applied for the program.
A lot of times my job is to just listen.
Just let the callers talk and process what's going on in their lives.
That's what she needed that night. Just someone to really hear her and acknowledge her pain.
I tried to get her to identify and focus on what matters to her, what brings her joy. She said her grandchildren. I asked, well, what would killing yourself do to them? And she replied, devastation.
One of the things we were able to do was focus on what helps her feel better other than cutting.
I did a lot of self-esteem building with the caller, learning what's important to her and what she enjoys.
I asked her what one thing she could do to change her situation, and she said she really wanted to sell the farm. She decided it was time to talk to her family about it.
COPE's other primary goal is to ensure that each caller has a defined next step, that they know what to do after hanging up. That might be taking a walk, following up on a referral, contacting a doctor or counselor, or dialing 911 if needed.
He said that after he hung up, he was going to listen to some of his favorite music and then try to get a good night's sleep.
By the end of the call, she said her anxiety level was down, that she was feeling a lot calmer, and was now ready to go back and help her daughters with their schoolwork.
Well, finally, she gave the gun to her husband and he took the bullets out.
I gave her our web address, ozakicountyresources.org, so her parents could check up for low-cost counseling resources.
He said he'd be fine that night and that he'd contact his sponsor in the morning.
She said she'd try to call again next time she was feeling overwhelmed.
Some people actually have COPE programmed into their phones to make it easy to reach us when they need to.
It's been said that being heard is so close to being loved that for the average person, they're almost indistinguishable. COPE takes the time to hear its callers, to encourage them, to help them identify and evaluate various options, to make them aware of helpful resources, to communicate support and empathy in a safe, anonymous, non-judgmental environment, and just to be there 24/7, 365 days a year. Does COPE make a difference? Every day.
Some people just find it easier to talk about these really private things with someone who doesn't know them, but someone who still cares.
She said our talk really helped.
And that it was easier to be honest when the conversation was anonymous.
She said it helped a lot to talk.
One mother called back to tell us the referrals we gave her worked and that her son was now getting the help he needed.
He said he was relieved to know that support is available because it's hard to clearly see your options when you're depressed.
One guy the other day said COPE reminds him that there are good people in the world.
She said she'd called COPE that night because she just needed to hear something positive that day.
Before we hung up, she thanked me over and over, saying she'd really been at the end of her rope when she called, and that now she had some options and some hope.